The Health and Social Services Minister, Dr. Kalumbi Shalunga, has pleaded with Windhoek residents to adhere to public health protocols as cases in Windhoek are on the increase. Namibia today recorded 70 new Covid-19 cases, of which 30 stem from Walvis Bay and 26 from Windhoek. The country now has 2,540 cases.
Walvis Bay and Windhoek continue to report the highest number of cases in Namibia on a daily basis. But it is the capital city that is currently of a great concern to the health minister. From the 26 cases reported in Windhoek, 13 are of confirmed cases, while the other 13 had no known contact with the previously confirmed cases. All 13 cases with no known contacts presented with COVID-19 symptoms at the time of testing. The cases are reportedly from different areas in Windhoek, such as Brakwater, Sibabasia, Saiterhof, Okapuka Nami Poultry, Freedom Square, Koreanghap, Grijsblok, Hoogland Park, Kommerstal, Klein Windhoek, Ombili and Wanaenda.
Of great concern is the Herero location, where 10 people were reported from. And we learn that these people attended a church event on the 25th of July 2020. Other people who were diagnosed earlier last week also attended the same church event. This is what triggered the attendees to go and get tested. However, not all of them were tested by then. It's likely that more people have been exposed. Therefore, we are cautioning people who have attended the same church event to call the hotline for guidance.
The minister calls on for community to avoid attending weddings, funerals and church services, as these are the main platform for spreading to take place.
It is also important that a register is kept at all time, and also for the citizens to provide the correct information, especially the names and the contact numbers.
Of the 70 new COVID-19 positive cases, 10 have been reported from Swakopmund, while Oshuarongo, Okahanja, Keetmanshoop and Oshakati registered 1 case each.
The case reported from Keetmanshoop is that of a 28-year-old Namibian male who arrived in the country on the 29th of July and who was deported from South Africa due to criminal activities, together with 2 others. They were tested in Keetmanshoop before they were transported to Windhoek under police escort on the same day and have been quarantined in the police holding cells.
The Okahanja case is that of a 33-year-old male from Orupuko. He was in conduct of a confirmed case, while the Oshuarongo case is of a 48-year-old female teacher who was only tested on the second visit at the local clinic. She tested positive and then was admitted to a private hospital, where she is reported to be in a stable condition. Dr. Shangula calls on health professionals in public and private hospitals to maintain high level of suspicion and quarantine patients timely.
The Erongo region remains the epicenter of the virus, with nearly 90% of all cases coming from there. Khomas region occupies the second spot with 8% of cases recorded thus far.
Out of the 2,540 COVID-19 cases recorded in Namibia thus far, 2,237 are from the Erongo region, representing 88%. The Khomas region have registered 204 cases, making 8% of the confirmed cases in Namibia. Erongo and Khomas are the only 2 regions to have recorded COVID-19 related deaths, with 10 and 2 fatalities respectively. The rest of the 12 regions recorded 4% of COVID-19 confirmed cases overall, with Karas in the 3rd place at 35 reported cases. Karas is followed by Oshodonjupa region with 20 cases, while Oshana recorded 11 and Ohangwena 10 cases thus far. 9 cases were captured in Hartab region, with Sambesi region having 6 confirmed COVID-19 cases. Oshikoto, Omusati, and Kavango East regions have all registered 2 positive cases. Omaheke and Kunene regions recorded 1 case each, with Kavango East being the only region in Namibia yet to register a COVID-19 case. While these numbers, especially in Erongo and Komas, might scare many, there is also an occasional good news, as most recoveries in a single day were also recorded today.
Again, this is a result of the change in our de-isolation policy. A total number of 345 cases have recovered and discharged. They are distributed as follows: Walvis Bay, 325, Oshakati, 6, Mariental, 5, Windhoek, 4, Okakarara, 1, Oshivarongo, 1, Oshikuku, 1, Outapi, 1, Keetmanshoop, 1.
The total number of recoveries have increased to 556, with 1,972 active cases, while the death toll remains at 12. Chester Wamunika, NBC News, Windhoek.